Chickenpox cases are rising in concerning numbers in India right now. I recently posted a short to YouTube and I got an unprecedented amount of views and comments. People are asking what to do, what to expect, what the symptoms are, and what can be done for home remedies. In this video, I'm going to help unravel some of the mysteries associated with chickenpox, including how do you catch it, what the symptoms are, what to expect, how long the disease lasts, and what you can do at home to try to make yourself feel better. Stay tuned to the end. I'll cover some of the home remedies. I'm Meg Conover, Physician Associate, Internal Medicine, and I'm here to help you unravel the mystery of chickenpox. I pulled up some of the news stories coming out of India. The Times of India has published some articles back in February and March. It looks like there have been 26 deaths in India from chickenpox over the first 3 months of this year. We're seeing numbers in the state hospitals in India of up to 25 cases of chickenpox per day. The cases from last year alone topped around 2,000. The contagiousness of this virus spreads by skin-to-skin contact and in the air, coughing or sneezing. It's usually seen in young children. There have been vaccines developed in other parts of the world that can help prevent it, but in India it's not as accessible. So the symptoms you can expect to see are fever, fatigue, body aches, feeling sick, sore throat, not wanting to eat. About 24 hours after that fever starts and you kind of feel sick, you're going to start to see spots. These are little round spots initially. They develop into bigger spots and then they become what we call vesicles, which are blisters and fluid filled. Eventually, those blisters are going to crust over. Lesions are going to pop up starting on about day 2 of your illness. You can get 250 to 500 lesions in unvaccinated individuals. These are really itchy and uncomfortable. Usually the number of lesions and the new lesions that are popping up decrease and stop by about day 4 or 5. Usually by day 6, most of these lesions are crusting over and you're gonna be less contagious. Because this is a virus, it's going to resolve on its own. There's no cure, no antibiotic treatment that can help. The virus usually lasts about 2 weeks total. You may be left with some dark spots on your skin from where the scabs have fallen off. Those usually heal all right on their own. You're gonna wanna try certain home remedies to help with the itching. Things I like to recommend are oatmeal baths, topical antihistamines like topical Benadryl, comes in a lotion form, and calamine lotion. This is the pink stuff that we use for poison ivy and poison oak. Put it right on top of those lesions, it'll help with the itch. And please, whatever you do not give any child under the age of 18 aspirin for any illness or body aches or fatigue. This can cause Rey syndrome, which can ultimately be deadly and cause coma. Most healthy people recover just fine in about 2 weeks with no complications. The at-risk populations include pregnant patients who have never had chickenpox before, immunocompromised patients or those receiving chemotherapy, those with cancer, those with rheumatoid arthritis, on medications. Their immune system's not as strong, so they are more likely to suffer the complications of chickenpox. These complications include superinfection. Scratching a wound can introduce bacteria. This can cause a skin infection, cellulitis, lead to sepsis. Pneumonia is another complication that you might see, and also brain swelling, brain edema known as encephalitis. Again, most healthy individuals are going to recover just fine from chickenpox in about 2 weeks. It's really uncomfortable. People are going to have to take time off of work and time off of school. So if you live in an area where the vaccine is offered, I highly recommend getting this vaccine. We usually give the first dose around 12 to 15 months old, but there are catch-up regimens and other regimens for both children and adults to be vaccinated. I'm Meg Conover, Physician Associate. Please hit the subscribe button if you found any of this information helpful, and I'll see you on the next one.